right, let's start with what's been happening with hookah of late. Now, recently Karnataka also banned hookah, yet another state to do so actually. And now, while we all know that cigarette smoking kills, but somehow the alternatives to cigarettes like hookah, shisha, vape, e-cigarettes, they are all considered less harmful. Is that really the case? Also, some feel that hookah is this age-old practice and tradition in states like Haryana, Rajasthan, for example, and generations of people have been smoking. So what harm could it actually do? So we thought, let's bring you an expert who can clear the air, quite literally on this one, and tell you the difference between hookah, vape, cigarettes, all of these, what are they doing to your lungs? Joining me now on TBC is Dr. Vivek Nangia. He's a chief of Pulmonology and Institute of Respiratory Critical Care and Sleep Medicine at Max Healthcare. Good morning, Doc. Thanks so much for joining us this morning. My first question really, are you on mute, Doc, by any chance? Because I can't hear you.
No, I'm not. Okay, maybe I need to speak a little louder.
Yes. Let's get our coffees and let's get into the day. All right. So, Doc, I first want to understand from you this whole thing of vape is less harmful than cigarette, hookah is less harmful than cigarette, shisha is less harmful than cigarette. Is that really the case, or are they all equal killers?
I think one is more than the other here. They're definitely not lesser killers than cigarette smoking itself. See, basically, we need to understand that the main components in all these is nicotine, which is causing addiction. And then these carcinogens which are there. In fact, if you see hookah, when you're smoking hookah, you're actually smoking more of the crude smoke. It's the charcoal which is burning. There is no filter in between. And then it's, water is supposed to be absorbing some of those toxins, but it usually doesn't happen. 1 hour of shisha session is actually equivalent to smoking some 100 cigarettes in a day.
Oh, wow.
So, you can actually imagine that on one hand, we're saying that cigarette smoking is not good. On the other hand, shisha, which is harming us even more. Another big disadvantage of shisha smoke is that, they use the same filter, which is, changed from one person to the other and to the other. So that sometimes results in quite a bit of infections being transmitted from one to the other. We've seen in our own practice also young children coming to us with tuberculosis of the lungs, primarily because they'd been smoking shisha and one of them had TB and then it spread to so many others.
I see. But this is, you're saying 1 hour of hookah, and why this happens is because it's a very social thing to do in a lot of clubs or in homes these days. When you sit down and the same pipe you're saying is sort of is taken around and they use it for longer hours, and that's 100 cigarettes. Wow, that's quite a number over there. But tell me, with vape, it's a very different story, right? Vape, the chemical composition only, we don't know what's in there. And that's the reason one has to not have vapes at all, because we don't know what's going in that liquid.
Yeah, definitely. Vapes have some flavoring agents also involved in it. These flavoring agents basically make you more addictive. They give you, especially the kids. And when you come around with the thought process that vaping is safer than cigarette smoking, then children tend to initiate, rather than using it as a quit smoking device, it is now being used as for initiating into smoking. That is one. Second is that the vape also, the vapes is basically what is an e-cigarette. E-cigarette means it's electronic nicotine delivery, which also has a battery in it, and that battery can sometimes explode and cause complications. In fact, in 2019, how we realized that vaping could also result in so much of lung damage was in 2019 in the US, some 98 adolescents got admitted to the hospital feeling breathless, choked, and when they got their x-rays done, there was diffuse involvement of both the lungs. So vaping induced lung injury is a new entity altogether that we've now been experiencing. In fact, in the last 1 month itself, we've had 2 or 3 young children getting admitted with us with vape lung injury, which we initially kept thinking that it's some kind of viral infection, pneumonia, acute respiratory distress syndrome. We kept looking for all possible sources till the time the patient themselves confessed to one of my junior doctors, said that they had been vaping. So that's how you,
And
because everyone.
doc, this is worrying. Why? Because vapes are also banned. So if this is happening and these patients are coming to you while it is banned, then this is a real cause of concern. One has to question how this hookah shisha ban will also be sort of implemented on ground.
Exactly, that is what we need to ensure. What is important is to ensure these bans effectively. Otherwise, it isn't possible to stop this menace of smoking, smoke. In fact, hookah also results in a lot of environmental smoke because it's all charcoal which is burning. So people who are not even smoking are getting harmed because of that, because of the secondary exposure to smoke, what we call as a passive smoking. Even normally cigarettes, when people are smoking cigarettes, one third of it is going into the patient, the smoker's lungs. Two-third of it is coming into the environment, which unsuspected
Got it.
people,
Yeah.
family members, are actually inhaling and
Yeah.
harming themselves.
Doc, when I floated this topic on social, some questions have come in, and one question somebody really wants to understand. But hookah, they say, goes through water. There's somehow this thing in their head that because there is water involved, etc., a lot of smoke is not direct, and thus it is less harmful. Another question that came to me on social again was about, but listen, so many generations in Haryana, so many generations in Rajasthan have been smoking hookah. In fact, it's a matter of pride there. There's one hookah that is tossed between the community a lot of times. Men, women sit separately on it. So what harm can it really do? Can you sort of shed some light on how this is actually not true?
Yeah, absolutely. So we only see these things which look very glamorous to us. That all these people who've been smoking hookahs for years, but how do we know they haven't been harmed because of the hookahs? The effect of the smoke is not just restricted to the lungs. We need to understand that. The effect of smoke inhalation could be resulting in a cardiac illness, like a heart attack, arrhythmias. It could be resulting in brain strokes. It could be resulting in skin cancers anywhere in the, starting from your lips, from where you start smoking, to your gums, to your tongue, to your throat, to your food pipe, windpipe, stomach, right till the urinary bladder. So it's the entire process that is going on. So we don't know how many of them are already harmed. Then chronic obstructive pulmonary disease, COPD, is so common in these patients. The chronic bronchitis, chronic coughing, emphysema, lung damage, lung cancer, people developing tuberculosis. These incidents, because their immunity goes down because of the smoking, these are very, very common in this population, which doesn't emerge ever because we don't have specific data. But definitely, if you look at it, there are, I think, about 13.5 lakh deaths that happen in India only because of exposure to smoke. Some
Wow.
18 million deaths, or
Yeah.
probably 80 lakh deaths, 8 million deaths globally happen because of tobacco smoking.
Another
So,
question, Doc, that happens is a lot of people say that, listen, I'm not addicted to smoking, I'm not addicted to tobacco, I just do it socially. I just do it over the weekend with my friends. Or the thing in Delhi NCR, which is very famous, I'm a winter smoker, right? Or I do shisha and hookah only occasionally. How harmful is that?
occasionally is equally harmful, I would say. One is that it's leading you to a nicotine dependence. Sooner or later, you will become dependent on nicotine. Nicotine has that addictive power in it. Second is that in winters, as it is in Delhi, NCR, we face so much of air pollution. On one hand, we talk about air pollution where the AQI levels are more than 400. 25 mics of this AQI level is equivalent to almost one cigarette. So, imagine if you have 400, that
Yeah.
means about 20 cigarettes or 40 cigarettes a day is what you're smoking in any case.
Yeah.
So, I think you need to be smoking on top of that anyway.
Right. So, what's the takeaway for me over here, Doc, is that A, you are still getting patients in your hospitals, and young patients with malfunctioned hearts, not just hearts, but lungs sometimes, and other infections, and all different sorts of, and it can't just be cancer, it will start with something milder because of vapes, because of hookah, because of smoking. So that's how serious it is, and that's how seriously all of us, should be taking this entire menace. Thanks so much, Doc, for joining us on TBC with these updates.
Thank you so much.